Hello, everyone. I'm very excited to be the first speaker in this interesting and exciting conference on autism research here in Israel. And so I'll be very happy to share with you some of the sort of hot off the press study, which is not yet in press, just finishing up data analysis. So this is exactly the time where I would like to present the findings and receive as much feedback as possible. And I'll start by talking a little bit about that study and also present some of some other ongoing studies that we have. Okay. So I think this is going to be some type of information that we all know, but I'll reiterate anyway. So as we all know, autism is a neurodevelopment disorder which manifests in early childhood and is also diagnosed for the most cases in early childhood. And there are also some early signs evident as early as 6 months of age. We know that around 1 in 59 children in the United States is diagnosed. Even some estimates put it at a higher level, and this represents a huge increase in the prevalence of autism. And in 2002, it was 1 in 150, and we all know that this is sort of a rising trend. We also know that there is a significant sex bias in the diagnosis of autism, so that between 2 and 4 males are diagnosed for every female. And this is important, as I'll talk later about sex hormones in autism. So when we talk about the etiology of autism, unfortunately, we don't know much, despite the fascinating talk that we heard from earlier today. We are talking about, and I'm showing the same figure here. We know that there are both genetic, biological, and environmental factors involved in the etiology. Some of them we know better. These are the 10% of the top left. There are a lot of other variation that we know much less about. And when we talk especially about environmental factors, we know that these factors must be present early on in development, because we do see these early signs of autism very early on as well. As I said, sometimes even as early as 6 months of age. And so if we're looking at the prenatal, the early environmental factors, one of the sort of time areas in life where we have to look is that the prenatal environment and the very early perinatal factors. And this is sort of what we did in this study. Now I want to, I don't know if it's a caveat or some sort of to make the setting very clear, that when we're talking about environmental effects, they are always mediated by biological factors. And when we think about sort of the maternal biology is reflected in the child's environment, and this may affect the child's own biology and the child's development. So what are the main environmental factors that have been discussed in the literature and sort of brought up in epidemiological studies and environmental studies? There are many of those. One of the main, sort of the top factors are advanced parental age, maternal prenatal medication use, infection, bleeding, fetal distress, and other risk factors. And the important thing here is that some of these there are a lot of co-occurrence between these different factors. So if you think about advanced parental age, specifically maternal age, is related to higher fetal distress, complication during birth. Bleeding is also associated. We have very intricate interactions between all of these factors. This is from one paper reviewing some of these factors, and we see that they're sort of related to each other. So we have a huge knot here of different factors. And our aim in the study that I'll present today is to think about how we can untangle these factors and maybe focus in on those environmental factors who are more specifically associated with a higher risk of or a higher incidence of autism in the children. So, as I said, many of these environmental factors are related. Another example is C-section prematurity. And many of the extant studies, and I'm sure we'll hear more about it today, sort of the big studies, examine how these factors are associated with autism, but many have looked at either very few specific factors, maybe not overall sort of all the factors that we can think of. I guess no study can do that, but we can try to capture as many as possible. Okay, so I want to sort of put a pin in that and talk a little bit about the hypothesis of sex hormone imbalance in autism. So we know that there is a sex bias in the diagnosis of autism. I mentioned that before. And we also know that in autism we see a male typical presentation of different psychological traits or behavioral manifestations. This figure comes from a recent study which was done on over 600,000 participants. And what we see here is that participants on the spectrum present sort of an exaggerated male prototypic phenotype. We see that with higher scores on the AQ, on the SQ, autism traits, systemizing, lower scores on the empathy questionnaire and the sensory profile. So this suggests that there is some role for testosterone or maybe some role for sex hormone imbalance in autism. This and other findings. So what do we know about fetal testosterone? First of all, as we said, that as testosterone is the principal male hormone, and we are looking at environmental factors or maybe biologically environmental factors that should be present early on in development. There have been many studies looking at fetal testosterone and its relationship to autism. So we've seen that fetal testosterone is inversely correlated with eye contact at 12 months, lower vocabulary rate at 18 months, and worse social relationships at 14 years of age. And in addition, it has also been linked to higher rates of autistic traits and even to an autism diagnosis later on. Moreover, when we look at the mothers, we see that PCOS, which is the polycystic ovary syndrome, it manifests as higher levels of androgen. It's been linked to increased likelihood of autism in the child. So if a mother is diagnosed with PCOS, there is more likelihood for a diagnosis in the child. And this is amplified as well if a mother is obese, which is also related to higher production of testosterone. This means that the maternal environment can have an impact on the child's exposure to testosterone, and this is important for when we think about sort of the testosterone or androgen as an underlying factor in some of these conditions, and I'll talk about it a bit later on. So the aim of the first study that I'll present today was to investigate simultaneously multiple factors which might be related to an increased incidence of autism, and also to see whether and to what extent these conditions are related to testosterone or sex hormone imbalance. And they're asking about both the medical history of the mother. 10 minutes? Okay, fine. I'll talk faster. Asking both about the medical history of the mother as a sort of pre-existing conditions, but also, so here is at the bottom you see maternal medical conditions, and including conditions that are related to sex hormone imbalance, such as PCOS, but not only. So, we also have autoimmune disorders and so on. For each pregnancy, the mother also filled out extensively about relevant obstetric factors, such as immune system activation during pregnancy, so if she has experienced infection, infertility treatment, and pregnancy, and we have 1,230 women of those, we selected mothers, right? Because we wanted to know about not only their own medical history, but the obstetric course for their children. So we have two groups of mothers. One group which reported on their first pregnancy, and here we have 557 mothers, and one group which reported on their second-born children, and here we have 374. At first we wanted to look at third-born children, but the sample size became really small, so we didn't go there. This is a description of the sample. You see here that we have 192 children diagnosed with autism and 365 typically developing children in the first child analysis, and for the second child analysis we have 105 children diagnosed with autism and 269 typically developing children. This is a bit about, again, the sample. You see the male-female ratio, maternal and paternal ages for both the firstborn and the second-born children. Okay. So what did we collect from the mothers? Okay, I'm going to do it. I know it's going to be a lot. I want to show you that we've collected a lot of information. Okay, these women filled out huge questionnaires. And we tried to pick as much information as possible. The aim was, as I said before, to try to take on as much information as we could and not pre-select what we wanted to look at. So I'm just going to go over quickly over the types of measures that we looked at. So we have information whether the mother or any family member was diagnosed with autism, the mother's and the father's age at birth, percentage of pregnancies which ended in miscarriage. We have several medical conditions, including different types of cancers, chronic fatigue syndrome, hyper and hypothyroidism, cholesterol, autoimmune disorder, PMS, PCOS, cardiac conditions, high blood pressure, failure to ovulate, which includes sort of the infertility issues, diabetes, epilepsy, infertility, and sort of an overall condition summary. Some of these conditions were quite low in terms of frequency, so whatever we could, we sort of clustered together. Some more predictors. We have about 40 predictors for each child analysis. So infertility treatments, hormonal medication, infection, bleeding, blood sugar medication, BMI, eclampsia and preeclampsia, hypertension, placental abruption, and so on. And also we have information about the child's gestational age and the child's sex. So we have a huge number of variables. We can't just run a regression analysis and try to figure out which one of them is an important predictor of increase in the likelihood of autism. Another factor in this is that some of them are correlated or related to each other because there's co-occurrence of some of these conditions. And so we opted to use the lasso approach, which is a machine learning approach where you select the variables which are most related to the outcome, and then you sort of throw away the other variables. And this allows us to really select the variables that are most associated with the outcome. And here again, I'm going to show you a long table with all the with all the variables that were associated with the diagnosis in the child. And you can see that there are some differences between the first child and the second child. And this is important because some of it is due to lower sample size, so we have less power when looking at the second child. There's also maybe when there are significant conditions, the women might be less inclined to become pregnant again. These are all considerations that we need to take when interpreting the results. What we see is that, as we would expect, family member diagnosis of autism predicts autism in the child. Mother and father age predicts. Percentage of miscarriages. You see that chronic fatigue syndrome, which is quite rare, but still is, we had some frequency in our sample. Cholesterol, PMS, fertility issues, diabetes, epilepsy, infertility. I'm just skimming, preeclampsia, and of course we have an association with child sex, and this is obviously something that we expected. So what can we conclude from this? First of all, this analysis allows us to select the most relevant factors from a very large array, which was not possible if you just did a typical regression model. It replicates some of the previous findings regarding family history and parental age, diabetes and infection, and also complications of pre and at birth. But also shines a line or emphasizes some other conditions such as infertility and hormonal medication use, which we saw here. It also de-emphasizes other risk factors such as placental abruption, infection of the amniotic sac, and treatments for preterm labor, which you can think about sort of the connection to oxytocin, atosibin, and so on. In another sub-study here, we compared siblings in the same mothers of those siblings, one who was diagnosed and the other who was not diagnosed with autism. Okay, so we have the same mother, the same father. One child is diagnosed and the other is not diagnosed. And here we had 132 mothers of 264 children. We did another lasso, which works with this type of data. We saw that high maternal BMI before pregnancy and maternal low weight gain during pregnancy were related to the child diagnosed with autism. Here we couldn't look at all the pre-existing conditions in the mother because we could only look at those that are related to a specific pregnancy. Here I'm going to go really, really fast because God is looking at me. So quickly, many of these conditions are related to sex hormone imbalance. For example, if you look at diabetes, we know that it relates to obesity. This also relates to higher testosterone. We have breast cancer, infertility. These are all conditions that are related to sex hormone imbalance. And this sort of brought us to think about whether this sex hormone theory, is it only relevant to etiology, or could it also be relevant to later development as well? What happens later on in life, and do these conditions or sort of the association with sex hormones relevant for later development as well? And for this, I want to first look at the picture. This is Cyril Simantov, a PG student in my lab, and she's going to present a poster at lunch, before lunch, after, something like that, talking about the relevance of various conditions related to sex hormone imbalance, timing of puberty, and autism diagnosis. So here we're talking about adults already, describing their life and medical conditions earlier on. So also the question is, what about puberty? And look at the scared teenagers there. Puberty is a very difficult time in life. It's related to many physical changes, which are prompted by a surge in testosterone. We have sexual maturation, increasing complexity of social environments, and less parental support. And this is all very difficult when we talk about typically developing adolescence, but it's extremely difficult for adolescents on the spectrum. So I just have to say this, talk just a little bit about our study, an ongoing study called Embrace Autism, where we have participants who are during their puberty, 10 to 16-year-olds with and without a diagnosis. We're looking at symptomology using the ADOS and various measures looking at empathy with eye tracking tests and parent and self-report. We're also measuring their puberty with both self-reports and salivary testosterone, Tanner stages, and also measuring social hormones. And I'm hoping that I'll be able to fill you up on it in the next National Autism conference. I want to say thank you to Simon Baron-Cohen at Cambridge, Mike Lombardo and Paula Smith, and also the Embrace Autism team here at BGU. And thank you for listening and being patient.